Dr. Carrie Jones is a naturopathic physician renowned for her expertise in women's health and hormone balance. With over 2 decades in functional and integrative medicine, she is often referred as the queen of hormones. Dr. Jones completed a 2-year residency in women's health and endocrinology at the National University of Natural Medicine and earned a master's in public health from Grand Canyon University. She was among the first to be board certified through the American Board of Naturopathic Endocrinology and is Menopause Society certified practitioner. Her professional journey includes roles such as medical director for Precision Analytical and head of medical education at Rupa Health. Currently, she serves as chief medical officer at New Ethics Formulations. Dr. Jones is also the host of the Root Cause Medicine podcast, which has garnered over 10 million downloads. Dr. Jones is dedicated to demystifying complex hormonal issues, providing clear, actionable insights to empower individuals in understanding their body. Her approach and candid communication style makes her sought-after speaker, consultant, and educator in the field of women's health. Okay, so let's just dive right into questions. Okay. Thank you so much for being here again. I really appreciate it. Also, if you're not watching on YouTube, you guys should see how cute her eyeshadow is right now. It's adorable.
Thanks. I learned it on TikTok.
Did you really?
Yeah.
No, I don't know how to do makeup at all. Should I just get on TikTok to learn or YouTube or something?
I literally am on TikTok to learn how to be an adult. There's so many things I've learned on there. For as much, flack as that app gets and as much craziness as that app brings, I've honestly learned a lot about just cooking, cleaning, makeup, gardening, my car, like just random stuff. I'm like, I didn't know that. Like nobody taught me that. I didn't know that was a thing.
Yeah.
So I have learned a lot on how to be an adult on there.
Well, I mean, the makeup is crushing today. So
thanks.
Yeah. So, okay, you've worked across labs, clinics, podcasts. You have a bunch of education. What is one thing, rapid fire, women still don't know about their hormones and that would absolutely shock them?
Honestly, one of the big things women don't know is that the hormones are the first to respond, but they are the last to course correct. What I mean by that is everyone's like, oh, fix my hormone, give me progesterone. What's the one herb that? I'm like, well, let's figure out why it's so dramatic in being a diva in the first place. Our hormones are like, as much as I love Mariah Carey, they're like Mariah Carey. I mean, if you're stressed, if you're not sleeping well, if you're not eating well, if you're overtraining, if you're undertraining, if you're flying, if you're sick, if you get infection, et cetera, et cetera, et cetera, the hormones are very reactive to that. So everyone jumps right to hormones. We have to back it up and look at the layers underneath as to what's going on. What caused the hormone to do that?
Let's go back. What about Mariah Carey here? Where is she coming in on this?
Because she's a dramatic diva. She's a diva. So that's how I describe hormones. Is they're dramatic and they're like the canary in the coal mine. They're the first to throw up a flag. They're the first to freak out. They're the first to send an angry text to management.
Yeah.
But it's with good reason. They're just the loudest in the bunch, like Mariah Carey.
Yeah, that's why she makes all the money because she's
It's why she makes all the money. It's why she's so successful.
So hormones are often blamed for everything from all the things that you just mentioned. What is one myth that you're constantly debunking when it comes to hormone health?
One of the big ones, of course, is that estrogen causes cancer. Just like across the board, full stop, estrogen causes cancer. And I have to remind women a lot, once you go through puberty, you have a lot of estrogen in your body for a lot of decades. And it's when you get pregnant, like if you choose to get pregnant, you're going to have even more estrogen in your body. And there's a lot of estrogen in your body and a lot of years you didn't have cancer. Now, can estrogen be part of the whole cancer plan? Yes. But is it single-handedly the only reason women develop cancer? Breast cancer in particular? No, cancer's complicated. There's so much that goes into cancer. It's not single-handedly estrogen.
I think that can be a whole podcast and weekend of itself, I'm sure.
Oh my gosh. and I can't understand the fear. There was this study, the Women's Health Initiative, that came out in 2002 that basically made every headline out there to say, stop your hormones. Hormones cause cancer, in particular estrogen. And boy, have we learned a lot since then. That's just simply not true.
Got it. You've seen women at every age. You work with all women from PMS, burnout, menopause. What is one sign that you would say that their hormones are just screaming for help, even if their labs could potentially say that they're normal?
Women inherently know. Fatigue takes on a lot of reasons. It doesn't have to show up in the blood work. Burnout can show up. in your person, in your body, without showing up in the lab work. Hair loss can show up in your body, but not show up in the lab work. There's your hormones can show up as a lot of symptoms that haven't moved the needle yet on the lab work, but you know there's something going on. You know you don't feel right. You know something's off. Someone described it to me not that long ago. They said, when you've organized your house as a woman, you've organized your house or you've organized a shelf and you know where everything is. And then one day you come in and it's moved. And you're like, who moved that? Who in the household moved that? And everyone's like, I didn't move it. You're like, well, it wasn't me. Somebody moved the thing. Like, I can tell it's moved. It's the same with hormones. When something shifts in our body, we just know somebody's moved the thing. And it may not show up on lab work, but we know something's moved.
This is great because I feel like a lot of what I talk about in the strength training world, which I know you don't do, is like listening to your body, right?
Yes.
Some days it wants heavy lifting, some days it wants rest or running or whatever it may be. Do you think that women inherently know what's going on with their body, or maybe they haven't gotten there yet and they haven't like really figured it out?
I think women know there's something going on with their body, but they don't quite know what it is. We weren't taught a lot about the female body, women's health, hormones, ever. If you think back to your health class in middle school, high school, elementary school, whatever it was, the progression of it, you probably got some very basic cursory things around your period. You were probably told if the P goes in the V, you're going to get pregnant, so don't do that. And that was about it. And then as we get older, if somebody's looking to become pregnant, we get more information about pregnancy. There's entire books dedicated to pregnancy. And then it kind of drops off the cliff. We have no information for women who don't want to get pregnant, but are moving through the decades. No information about women who suddenly hit 45 and feel like they've been in some sort of horrible accident, yet there they are, and they look in the mirror every morning going, what's wrong with me? So no, we don't get the information. It's a big disservice. But yes, women know something is going on.
I think women like you and so many others are paving the way to a lot of the menopause, perimenopause talk and women that are aging, but also just like getting to know ourselves and our body even more. Just like you said, there wasn't that education in 2002 when you were talking about that study. Yeah. Now I think there is more education, but do you feel like there might be a little confusing or conflicting information?
Yes, it's like the floodgates have opened. So we went from not hardly any information to millions and millions and millions of bytes of information. Absolutely. And so it's someone like me who's been in this industry. I graduated from medical school in 2005, and I have only done women's health and hormones my entire career. So 20 years of doing this. So I have 20 years to accumulate, figure out, research, read, put together this information. If you're listening to this for the first time, you may feel like you've just swallowed an entire fire hydrant of water, and it's very overwhelming. And because hormones shift and they change and everybody's different, everybody's an individual, it doesn't mean that the guidelines apply to you. So you hear online about the guideline or this is the only way to do it. And then you listen to somebody else who says, well, actually, no, you don't have to do it that way. And so there's conflicting information, even among the experts around the quote unquote right way to go, the right way to prescribe, the right way to live your life. And, take what you can, take what fits, take what resonates, and leave the rest.
How do you know what to take?
We have to start with the basics first and foremost. So a lot of women are just trying to understand, like, what is a hormone? Like, what's going on with my body? Why am I not making hormones like I used to? Why am I having all these symptoms? And then we go back to that, peeling back a layer. Okay, are you eating nutritiously? Are you moving your body? How's your stress? Are you sleeping? Are you hydrated? We go into all of those second. And it's like a tiered system. The bottom of the pyramid is the basics. And then we can go up from there. So if women are listening thinking, man, I'm not even drinking enough water in my day. I haven't worked out in days. My stress is a level 10. I'm not sleeping. Then, okay, we have to dial that in first before I jump into some of the advanced stuff. But if somebody listening to this is like, no, I am dialed in. I am so disciplined, and yet my body is having all these hormonal symptoms. I'm like, fantastic. All right, let's do maybe some lab work. Let's evaluate supplementation. Let's figure out if you do or don't need hormone therapy at this time. Like, let's really try to figure out what's going on and get into it. So I always tell women, you're hearing everything out there. Like I said, there's millions and millions and millions of sound bites out there. What fits for you? And just start with that. I mean, even look at protein, right? There's the jokes on the memes of eating enough protein in my day is a full-time job. Well, if that doesn't resonate with you, then start with some protein, right?
Yeah.
If you're not eating any protein, don't jump to 130 grams of protein. Jump to just getting a little more protein in your diet. If you don't drink water, start drinking some water. Think of yourself as a house plant. Like, have a couple of glasses. Next week, have a couple more glasses. The week after that, right? It just sort of like builds on itself, because I've heard the gamut. I'd seen patients for years that I can't institute a level 10 treatment with somebody who's still at level 1, who still, doesn't believe in water and lives off coffee and stress. We have to meet the person where they're at.
I love that. And I resonate so much with that as a fitness professional. But let's break it down. So now let's go back to, what is a hormone, Dr. Carrie Jones? Tell us what it is.
Yes, a hormone, think of it like a text message. It's essentially a little chemical messenger that floats through your system. So you have a gland, and in this case, let's say estrogen, estradiol, which is our main estrogen. Predominantly is made in our ovaries. It's made elsewhere, but it's predominantly made in your little ovaries. And then it goes out into circulation like a text, and it goes somewhere and tells it to do something like a text. So that little estrogen will go to your bone and says, hey, bone, do your thing. Let's grow. It'll go to your brain. So it'll help parts of your brain with memory, your thinking, or mood, as an example, right? It goes to your skin. It says, hey, collagen, do your thing. Make some collagen. Your collagen says, cool, I got you. So this is what estrogen does. It's a text. You have other hormones that do other things. Progesterone is a hormone. Testosterone is a hormone. Yes, women have testosterone. Thyroid hormone. We talk about thyroid hormone all the time. All that you're doing is going around telling pieces and parts of your body to do the thing or to not do the thing, depending on how it's communicating. Now, here's the interesting part. You can have too much. So now you have too many texts coming out. It's like when somebody individually texts every single sentence or word, and now your phone is going off constantly, versus somebody who texts you a full paragraph. Or somebody who you've texted and you're like 4 hours later, still haven't heard from them. You can have too little hormone. So you're like, hey, I'm waiting for your response, but they haven't texted you back. It's the same in your body. It's just a messenger.
I love that analogy. Are you the analogy queen?
Because yes, I love analogies.
I love it.
I love analogies.
So valuable. And it's so easy to digest. I'm like, oh, okay. I wonder which text messages. So now, can you tell us, you told us about estrogen. Can you tell us about progesterone and testosterone and where those texts are going and what you should or should not want from them?
Absolutely. And actually, we'll step back into how the text is made in the first place. So
I love it.
Whether you want to or not, as a woman, your body centers around reproduction, making a baby. You have 11 other systems in your body that function and need hormone, but the primary thing your brain is concerned about is whether or not you're healthy enough and strong enough and happy enough and all the things, you have the right growing conditions to grow a baby if you wanted to. So it all starts in the brain, and the brain dictates your cycle. So if you are a 28-day girl or a 24-day girl or a 35-day girl, that's all dictated by the brain. So the brain sends the first text message, a part of your brain called the hypothalamus, sends a message to another part of your brain called the pituitary. And the pituitary decides based on the message, am I sending out estrogen right now? Or am I going to tell the body to make progesterone right now? So the first thing in the first part of your cycle is you get the text message to make estrogen. So you make estrogen in the first part of your cycle, and that's to prep your follicles because you might get pregnant. Now, you may be listening to this still thinking, no way. I know, just bear with me. It's what the body wants to center around. So you make estrogen first. Then you have to ovulate or release the egg. So now estrogen drops down, so that text message goes away, and a different text message comes out. It's called luteinizing hormone, LH. You get one text message. It's go time. It's sent with slam effect. And then you release the ovary, the ovary releases the egg and you ovulate. Then the brain says, okay, cool, we've released the egg. Now we're going to start making progesterone, because progesterone in its name is progestation. It helps make the uterus fluffy. It's nesting. It wants to be, a good place for implantation should you want to do that. Progesterone is also calming, soothing, relaxing. So it helps you not have PMS. It helps you have a nice, easy period when you get your period. It helps you not feel anxious. It's a great hormone to have around, and it counters estrogen. Estrogen is go and grow, whereas progesterone's like, oh, let's nest. Let's be calm. Let's be cool. Let's crave chocolate. Like, we're good. Then, if you're not pregnant, both of those text messages fall off. They stop responding. And the body goes, all right, well, I didn't get the text message we're pregnant. Let's have a period. So war is declared and we bleed. And then we start the whole thing over again, all because of these messages. And so it's this up-down effect, like a roller coaster, that's the same every time. We have an up-down of estrogen in the beginning. We have a loop-de-loo for ovulation. And then we have the up-down of progesterone. Then you get your period and you start the whole thing over. So that's estrogen and progesterone. In there, you always make a little bit of testosterone. Testosterone, helpful for bone, helpful for mood, helpful for muscle, helpful for brain, helpful for libido, right? We need a little bit of testosterone. It doesn't really follow any kind of up-down loop-de-loo. It's not a roller coaster. It's pretty static all month long, except you do get a little tiny boost right before you ovulate, release the egg, because the body is like, hey, just in case you want to get pregnant, we're going to bump your libido up, give you some good feelings because you're about to ovulate, release the egg. And then I'm going to drop back down into my normal range and continue forward. So all these hormones get centered around the cycle, but they have extreme systemic effects. Like I said, bone, brain, mood, skin, right? Like all these things play a role with hormones. But the center is around the cycle.
What if I just want to turn off my phone at this point? There's just a lot of text coming through right now.
I joke all the time that if I was, I would love to be the goddess of the female body. I don't want to be the goddess of the universe. That seems like a big job. But the female body, I would love to have a switch. Imagine if we could just be like, no, thank you. Like, not this month. Like, I am not interested in getting pregnant this month. And you just press a switch. No, I still want my hormones to protect my brain and my bone and my heart, my skin and all the things, my mood. Like, I just want to turn that barrage of text messages off. Like, let's not get pregnant. Versus other women listening might be like, no. I flipped that switch on. Like, I am been trying to get pregnant. Keep it on. I just wish we could have it that easy.
Gosh, that's such a great explanation. Thank you so much for breaking it down like that. It felt so digestible. So let's keep talking about hormones because I feel like you have so much here. And then I definitely want to get into cortisol because I know that's a huge topic of conversation too. So functional labs for like testing your hormones are powerful, but they can like not be accessible for everyone. For someone who doesn't have access to testing, what are some signs with the hormones you just told me that they could be out of sync, and how can they start kind of course correcting themselves?
A lot of the estrogen progesterone signs are similar in that too much estrogen or too little progesterone can be the same thing. So if your PMS is bad, if you've been told you have PMDD, premenstrual dysphoric disorder, if you have heavy periods, if you have long periods, irregular periods, if you have pretty significant cramps, if you have pretty significant clots when you get your period, if you have breast tenderness, if you have a lot of bloating, if you're really moody, if you're having terrible cravings, like right away, I think if you've ever experienced this, you know, like, oh, it's my hormones. That's what's going on. Now, libido is a little tougher. Automatically people go, I have no libido. I used to, but I don't anymore. That must be testosterone. And while testosterone does play a role, actually all the hormones to a degree play a role because being in the mood, the actual mood, am I stressed out? Am I feeling depressed? Am I feeling anxious? All the hormones can contribute to that. So we can't just say testosterone's only low libido, although low libido is an indicator that something is probably going on with the hormones, assuming all is right with the relationship and it's just like I used to be in the mood, but now I'm not, then we have to look at the hormones as a whole. And usually women who have been dealing with their hormones since puberty, they're pretty in tune to that, where they're like, oh my gosh, my PMS is the worst. Or, oh my gosh, my cramps are terrible. Or, oh my gosh, I get all these symptoms the week before my period, and then surprise, I get my period and it all goes away. Estrogen and progesterone are usually the two creators of havoc that are the reason you get those things.
Now, are they able to course correct on them on their own?
So on their own, in that if you don't necessarily need to have fancy supplements or medications, but if you are listening to this and you've been very stressed out, let's say you've been traveling time zones quite a bit, again, overtraining, undernourishing yourself, you've been really sick lately, you've had, an infection, long COVID, you maybe you have little kids and you got, you first you got a cold, then you got a flu, then you got like you just keep, like your kids keep coming home from school as little, germs that they are, and then just passing it through the family. And you're like, why is my cycle so crazy? So as you address those things, yes, they can course correct. I fully believe they can course correct. One of the times, though, they can't really course correct, where it's more struggle, is when women get into their 40s and early 50s and they're perimenopausal. Because at that point, the ovaries are not receiving the signal from the brain. The text message is like, it's coming, but like nobody's reading it. Nobody's looking, or they're over exaggerating. And so they go from not a lot of hormone to suddenly too much hormone and then back down again. So they feel like they're on this wild ride for several years. And that can be much harder to, let's say, course correct with diet and lifestyle, stress, nutrition. While those things are very, very important, I say this because I have a lot of women that go, I do great. I'm very disciplined. I'm a 10 in all areas of my healthy life. And still, I turned 45 and everything fell apart. I'm like, oh, I know. Your ovaries stop listening to the text messages. And as a result, now we have to do maybe some more intervention.
Got it. And this is?
So it could be start with supplements, depending, but definitely can include hormone therapy.
Now, I'd love to talk a little bit more about some of the lifestyle changes that you can make to kind of course correct those, like specifically nutrition. Could you give any tips or supporting hormones without overcomplicating it when it comes to nutrition?
Absolutely. One of the big things with hormones, your hormones are excreted or detoxified through your kidneys and through your intestines. So when we think about detoxification, I'm sure people have heard of like go in the sauna and sweat it out. And sweat is a great way to detoxify, not your hormones. They either get pooped out or they get peed out. So are you hydrating? Are you drinking enough water in your day? You probably need to add on a little bit of electrolytes or minerals so that you can absorb said hydration, and then, good kidney health. Then we get into nutrition part of the intestines. So are you eating a diversified diet? Are you eating the rainbow? Are you eating vegetable? Let me just start with the basics. Do you eat vegetables? A number of people who are like, oh, I mean, I get some carrots at lunch. I'm like, not quite. We need to diversify a little bit. Are you getting fiber? Fiber helps with bowel movements. It's important for the diversity of what we call a gut microbiome. So all the little living little creatures that live in our intestines, actually from our mouth all the way through our intestines, that help us make vitamins and transform hormones and detoxify and keep us, balanced and healthy. They love fiber. So are you eating things that, ground flax seeds? Do you eat, my favorite is jicama. Jicama is, I like to cut it up, a little coarse sea salt on there. It's great for fiber. Are you eating, again, vegetables? Are you getting greens in? Are you getting enough protein? I joked about protein earlier, but if you are at this stage and you're looking to not only maintain your muscle, but add some muscle, because you might be losing some of your lean muscle, you got to have protein to do it. And I am completely guilty of this. I was way under eating protein for many, many years, not realizing salad with a little bit of chicken, 2 eggs in the morning, like that's hardly any protein. I need to be in the 130, 140 gram range for protein. And so just by shifting some of your macros, looking at diversity in your vegetables, getting some fiber in, making sure you're drinking enough water is a great start.
I think protein had a moment for a while, and now it's actually all about the fiber. So I appreciate you talking about different ways to eat fiber, but I still feel like people are like, where do I get it? How do I go? Jicama, I actually haven't, the only time I ever eat jicama, Carrie, is when I'm on vacation on the beach.
Yes.
And it's like exactly what you're talking about.
Yeah.
Do you have any other little tips for fiber, how people can add that more into their diet?
Yeah, diversity of vegetables.
Okay.
Right. You can use, there are fiber supplements out there. Of course, there are fiber powders. You can add, ground flax seeds are one of my personal favorite, because ground flax seeds, to a small degree, can act like a phytoestrogen. So it can be supportive of estrogen just in general, but also is a great fiber. So adding that to whatever you're cooking with, or, yogurt, or, whatever you're doing. But just to keep it really simple, vegetables or beans. Are you getting beans in? Lentils? Are you diversified in that way? If you can eat those. And so it doesn't have to be that complicated, or honestly cost a lot of money with a whole bunch of supplements for added fiber. You can go that route. But if you sit back and look at your diet and go, I'm only eating carrots, I have a little bit of greenery, at salad, the greens at lunch, and that's it for my day. We need to increase that.
It's so funny you say carrots because I literally put that on my lunch, like with a sandwich or something at lunch every day. As
Yeah.
my
Oh,
like
I'm not opposed to
vegetable.
it. I should say I'm not opposed to carrots at all. And in fact, if you're going to eat carrots, you should eat washed, unpeeled carrots. I've been saying this for decades at this point.
Okay.
So carrots do have great fiber in them, and the outside of a carrot. So don't peel it, just wash it. So the outside of a carrot and the inside of a carrot, it's a little bit different fiber. It's a twofer when you eat your carrot. And I'm not talking baby carrots. I mean, eat a carrot, like a real carrot, like Bugs Bunny, if you remember that. But that can help significantly. That fiber, we have an enzyme in our intestines that either does or doesn't help escort estrogen out of the body. If you have too much of this particular enzyme, then it'll pull estrogen back in, so to speak, and then you reabsorb it. So carrots are one of the great vegetables because it has a little bit different fiber on the outside and the inside, that it keeps this enzyme in check so that estrogen can get released when it's time to go. And so I'm totally fine with carrots. But sometimes when you ask people, do you eat vegetables? Like carrots, the only thing they can think of. They're like, ooh, carrots? I'm like, yes, big fan of carrots. What else do you eat?
Yeah. You heard it here first. She says, eat the carrots, but eat it unpeeled. Very interesting. I
Unpeeled.
definitely always peel it.
Unpeeled, wash it, scrub it clean, but you want that outside layer of it, the fiber in there, quite healthy. And honestly, try to go for organic because carrots grow in the ground and they can suck up things you don't want them to suck up if it's not an organic carrot farm.
So let's dive into cortisol because I know that's
Yes.
a lot of what you talk about. Let's just go ahead and start with what is cortisol? Why does it get such a bad rep, especially in the fitness and wellness world, which is what I'm in?
Poor cortisol. My gosh, everyone talks all about so negatively about cortisol. So cortisol, we call it our stress hormone. It is made, we have two little glands on top of each of our kidneys called the adrenal glands. And cortisol is meant to help us handle stress. That's usually what people say. Honestly, if cortisol had a resume, the very first thing on cortisol's resume is I increase blood sugar. That's what it does. Now, before you panic and think, oh no, I don't want high blood sugar. That's a bad thing. Think about when you had to skip lunch because an appointment ran late, a meeting ran late, whatever. Your body still needs glucose to increase, and cortisol increases glucose. So it's like, I got you, not a problem. You can skip that lunch. I'll make sure you have enough glucose for your brain and the rest of your body until you can eat again. Cortisol can also be anti-inflammatory to a degree. So if you've been sick, if you have a headache, if you hurt yourself, cortisol will go up to help you manage that. It'll help communicate with your immune system and everything, inflammation, everything that's going on. So we need cortisol in its reference range. We need it to go up in the morning and down at night. This is what's known as our circadian rhythm. Helps our glucose, helps inflammation, helps our stress response. Here's where it gets the bad rap. When it's too much or too little. So it's like Goldilocks in the Three Bears. If it's, too big or too small, we have a problem. Too much cortisol chronically, like all the time, now can interfere with our immune system. So it can actually make us feel more sick, get us more prone to being sick. Too much cortisol can actually increase water retention. So now we might feel puffy and fluffy. Too much cortisol can also increase, again, glucose. It can increase the risk of metabolic syndrome. So weight gain around the middle, specifically visceral fat, the inflammatory fat around our organs. We don't want that. Too little cortisol, and we're definitely tired all the time. We're not as motivated. We don't have that oomph. And again, can increase the risk of infections because we don't have the cortisol to get over the sort of the hump of it. And so it gets this bad rap because we see the two extremes and go, oh my gosh, I don't want high glucose. I don't want, to deal with inflammation. I don't want belly fat. I don't want puffiness. So I'm going to do whatever I can to suppress glucose or suppress cortisol. But really what we need is cortisol to be in its natural rhythm. It goes up in the morning and then down at night. And we don't want it chronically elevated.
That's beautiful. I love all these analogies so much. Goldilocks and Three Bears, I could literally vision. And I was like, oh, it's this house. So can you break down the difference then between healthy cortisol spikes, like you were saying in the morning, and then the kind that work against us?
Yes. So in the morning, it's called the cortisol awakening response. And it happens within about the first 30 to 45 minutes of you waking. And still some people freak out and go, but I didn't think we want a cortisol spike. You do in the morning. And you do within a certain range. It will go up like a mountain. And it's to give you some glucose because you've been fasting all night. Not a crazy amount. It shouldn't, but just enough to get you going. You're fasting. It's to get your butt out of bed, get you motivated, give you some energy. And it's to reduce kind of inflammation, pain, etc. So for people who go, yeah, gosh, I wake up, my joints kind of hurt, I'm kind of stiff. But after about, 30 to 60 minutes, I feel okay, I'm moving around. Cortisol can play a big role in that. So once it goes up, it comes back down and gradually down, 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 so that when you get to nighttime, your cortisol is nice and low in the reference range, so you can fall asleep and stay asleep. And it's the opposite of melatonin. Now, melatonin comes out, your sleep hormone, and then we just flip back and forth all day. Cortisol in the day, melatonin at night. So I always say cortisol is like the sun, melatonin's like the moon. Now, when you get a stressful situation, you are driving and somebody next to you nearly hits you and you have to like cat-like reflex, move and hit the horn and make sure you're safe. Believe it or not, that's adrenaline. Immediately what comes out is adrenaline, known as epinephrine. Cortisol comes out about 10 minutes later. It's a little bit of a lag time. But if you are chronically stressed, you have a big project due, you're going through a divorce, you're having a lot of trouble with your children, there's something, you're chronically exercising. Now your cortisol's up all the time because you're ringing the alarm all the time. In some cases, it's survival. There's nothing you can do. You're doing the best you can. In other cases, you may be listening to this going, yeah, I definitely am making mountains out of molehills. I'm definitely dramatic. I definitely overreact. I'm definitely causing some of these issues when I could be paying better attention to my body. But that excessive overreaction of cortisol is now affecting your glucose, your blood sugar. It's now impacting, even like your muscles. Cortisol is catabolic. It breaks things down. So it's supposed to go up and down through the day. But if it's up often, you may find you're struggling to put muscle on. You may find that the lean muscle you did have isn't there like it used to be. It can be hard. You may hurt a lot after your workouts. You have more, like you feel like you're breaking down as opposed to building up. So we do need to pay attention to cortisol, but we don't need to vilify it for everything.
How should we be paying attention to it?
Stress is the big one that I find. We want to be resilient as humans. But when we look at our life, what are we doing to take care of ourselves? What are the bigger stressors we have? Are we able to understand when something does warrant a cortisol effect, or are we making mountains out of molehills? When we look at stress, there's all kinds of stress. There's physical stress, mental stress, emotional stress, environmental stress, et cetera, et cetera. Now, your body, this whole like cortisol stress system is part of the fight or flight system, your nervous system. It doesn't know the difference between real stress, anticipated stress, and imagined stress. So if you have a tiger right in front of you, that's real stress. You should freak out. If you can see a tiger coming down the way, that's anticipated stress. If there's no tiger anywhere around you, but you're the kind of person who's like, I just know it. I know there's going to be a tiger. Like, it's going to happen. It always happens to me. What happens to your nervous system? It's like, well, all I hear is tiger, and tigers freak me out, so I'm going to react. But now put that towards anything in your life. You may have a different stressor every day, but it's always something. And that's what you keep telling yourself and your friends and your family. Oh, my day was terrible. It's always something. Or you may be actually going through something pretty significant, right? Like illness, infection, divorce, job change, move, like big things. So now I'm like, okay, what can we dial back on? What self love can we give? What boundaries can we set? Where can we say no? So I find the mental, emotional part of stress is the hardest to manage compared to physical stress, like the pain that you're in. You know what it is. I've hurt my knee. I'm in pain. Okay, it's my knee. Got it. Like I know what that is. But the mental, emotional is harder because life can be hard right now. Life can be intense right now. There's a lot going on right now. So again, back to like boundaries, saying no. How are we taking care of ourselves? What are we doing for ourselves to pull our nervous system out of that fight or flight so we're not always feeling that way?
What are things that you, Dr. Carrie Jones, do to manage your stress levels?
Well, I'm still learning. I mean, even as it, right? Like I'm still an adult. I'm not a perfect adult. I'll give you a really funny example. Well, it's a good example of emotional stress and how it impacts the body. I was wearing a continuous glucose monitor in my arm, so monitoring my glucose. I happened to swipe it before I left the house to go run errands, and it was in the 80s, which is perfectly normal. Then I got a really terrible text message. I was so irritated, like dramatically irritated. I was so mad. So I get in the car to go drive to wherever I was driving to run errands, and the whole time I'm arguing in the car with how I'm going to respond, and how I feel. And, I'm just like losing it over this text message. And in the 20 minutes it takes me to get to the store I was going to, I swipe. At the time, now it's connected to your phone, but at the time back then, you swiped the CGM on your phone. And I'd gone up like 20, 30 points because my body was like, we're about to fight. Must be a tiger. Like, let's go. I'm going to give you blood sugar for your brain, your blood sugar for your skeletal muscle. You need to run. Like, where is the battle? Like, what's going on? So I was very proud of my body for responding. That's a normal response. I was not very proud of me and how I handled the situation. So now I work really heavily on things on, not making mountains out of molehills. I think of the story often before I get really mad at a text or a phone or an email or something. I exercise regularly. I journal every single morning. I do a lot of gratitude work. I do a lot of deep breathing, diaphragmatic breathing. I don't do, and I don't mean to call him out negatively, but like Wim Hof breathing, where they're like they're really fast. If you're already in a stressed out state, that might just push you further into, oh, we're running. Like there's something wrong. We need to calm, we need to keep going, and I want to calm down. So I do a lot more of that deep, slow diaphragmatic breathing to try to help. I say no a lot. I forgive myself a lot, set boundaries a lot. So it's still a work in progress, but I think it's important that everyone listening, if you haven't given yourself permission to do any of these things, give yourself permission to start doing some of these things.
And obviously, as we all know, they get easier when you do them more. And so try and stay as consistent as you can. But choose, if you're someone that's like, oh my God, that seems like so many things to do, like we were talking about earlier, choose one of those things.
Yeah.
Just journal once a week, or just breathe, once a day. Just even, forgive me, are you doing like box breathing, like a 4-second in, 4-second hold, 4-second?
I will, box breathing is part of it. Yeah.
Yeah.
Yeah. It's not always box breathing. Sometimes it's just breathe in for 4, pause at the top, breathe out for 4, pause at the bottom, breathe out. But I make sure my lower rib cage is going in and out. Some people will do box breathing and they still stay in their upper chest. Like their whole upper chest is like they're puffing their chest out to breathe. Whereas I'm trying to remind myself to breathe low, make sure my I'll even put my hands on either side of my lower ribs and make sure that that's expanding out, because that's where the diaphragm is. So I'm trying to stretch that out and in, and is part of my breathing. And you're right. I love that you said that. Remember, I've been like you, like I've been in this business a long time. So my chapter 20 is different than somebody listening who's only maybe just dipped their toe into this. I've added these in and learned these things through the years. Even something like emotional freedom technique, EFT tapping, one of my absolute favorites. And I just pulse it in when I need it. Breath work, I pulse it in when I need it. And the things I really resonate with, for me, I love to write. So journaling makes sense to me. So every morning I write, as opposed to just occasionally. Somebody listening to this may be like, man, I love writing. That's a great idea. And others my best friend she's never, ever, but she likes to meditate.
Yeah.
So she does her 10-minute meditation. And I think that's great.
Yeah. You find what works best for you. Yeah. I will say with the journaling thing, I always tried it for a long time, but I like to hear myself talk. So I have a podcast. Yeah. So I'll do voice notes. So I'll have voice notes, and I'll just have like a diary of voice notes for myself. And then sometimes when the voice is really loud and mean, I'll voice note it and I'll be like, what did you just say to yourself? And I'll never want to say that again. Yeah. So it's nice to just kind of like get it out either on paper or out of your head, basically, either way. So I love that.
Absolutely.
So let's talk about the stress of exercise, because obviously there is stress that's involved in exercise. How do we know when our workouts are doing more harm than good from like that hormone cortisol standpoint?
Well, often, and you definitely can speak into this probably a lot more, we need resiliency. So, I want people to move their body and I want them to exercise. Yeah. But what I don't want them to do is to be that weekend warrior who does nothing and then they go at a 10 out of 10 and now they've hurt something, or they're all out of whack, or they're, sore for days. So we have to find that happy medium. So with women in particular, especially when it comes to hormones, I'm like, all right, if you've never exercised in your whole life, like we're going to start low and slow. Let's see what you can handle and then go from there. But if you're somebody who is, off and on exercise, or you have a pretty good exercise routine, then, can we move up? However, I will say this, your hormones are going to adjust first. So let's say you've started an exercise program and you're like, I'm going to do 75 hard and I'm going to go all out and I'm going to be really intense, and your next period sucks. And in fact, the period after that sucks, and your mood sucks, and the things coming out of your mouth suck. And now maybe the people you love in your life are like, hey, you're not that fun to be around anymore, or you're really tired. You just feel depleted all the time. And you're trying to push yourself and you're trying to, cross off the boxes so that you can just get through this. That's how I know it's too much. That's how I know we probably have to dial it back, because it's impacting your hormones, it's impacting your energy, it's impacting your mood. And now it's becoming a chronic problem versus, oh my gosh, when I do this exercise, I feel amazing. I feel like I started out maybe like not that motivated, but by the end, I was so glad that I did it. I'm feeling so strong in my body. I'm feeling so good. I have good energy. And when you don't, maybe it's a rest day. Or maybe you just dial it down, cut it in half, whatever exertion you're doing. So that's what I go by. And women are usually quick to tell me, and they probably tell you the same thing. Like, I'm just exhausted all the time. I'm like, all right, it's too much. It's too much.
Yeah. And obviously, there can be so many stressors that are involved in that too. But
Yeah.
I would say I made this post a couple months back that said you don't need 75 hard, you need 365 medium.
Yes.
And
Oh
that
my
really,
gosh.
and that
Yes.
really is what everyone needs. You don't need 2 workouts a day. You don't have to do it all, because then that's when your body can't hold it. It can't be sustainable. And it's just so hard to hang on to. And so, of course, there are people that will want to do it, and it's great for them to start their journey. But I'm very much come from the boat of like, how can we slow and steady get
Mhm.
to the place that you want to be? Even if you
Right.
want to work out 5 times a week, you got to start with one first.
Yeah. And it has to be a lifestyle adjustment.
Exactly.
When it comes, especially as women get older, I'm in my late 40s. And so I have been modifying and adjusting and changing again, like the last 20 years. And so I see my whole lifeline ahead of me. My family in particular lives a very long time, into the 90s. There's a pretty good chance I'm going to be into the 90s.
Yeah.
So this is a long game. This is like 401k investing for me. Like I'm putting it in knowing this is a lifestyle change versus, and again, I don't mean, I'm not like talking crap about 75 hard, but it's 75 days. And then some people are like, cool, I'm done. Like, whoop,
Yeah.
got what I wanted. I'm out. Thank goodness.
Yeah.
Whereas I love what you said. It's 365 medium. Cause I'm like, no, this is lifestyle. This is the rest of your life. We need to make these adjustments because your hormones are in your body for the rest of your life to some degree.
Yes. So you had mentioned this, and I've heard this a lot from clients. I feel like I'm doing it all, or I feel like, what did she say? Something like, I feel like I'm doing all the right things, but I'm constantly tired or my energy's low.
Yeah.
And if it wasn't them doing too much, where else do you think they could potentially manage that?
So when I hear that from women, and I hear it a lot,
Yeah.
I go to lab work.
Okay.
And the reason is it's possible you are iron deficient and have no idea. It's possible you're B12 deficient and have no idea. Vitamin D deficient and have no idea. It's possible you have a thyroid issue at this point and have no idea. Because if fatigue is your number one symptom, and you go look up, in WebMD, or you Google your symptoms and you're like, fatigue, everything starts with fatigue. It could be anything. So
Yeah.
we are talking about hormones for sure. However, I don't want to miss anything either. I would hate for you to go, oh, I'm sure it's just stress. I've been trying all the things. I'm so disciplined and it's not getting better. And the whole time you've been iron deficient, iron anemic. I'm like, oh, we can remedy that. Let's figure out what's going on. And so now it might be time for some blood work.
How often should someone get blood work done?
At least yearly. I am in the camp of at least yearly because I will say a lot of times insurance will cover a lot of the basics and then part of some of the more advanced testing. They may not cover all your vitamin D, but they may cover 80%. But they're going to cover your cholesterol, your glucose, like they'll cover those things. So if you can afford to get it yearly, then that's ideal. Once you hit about your, let's say, early 40s, I might, depending on your symptoms and family history and all these things, I might be looking at some of these things twice a year. Here's why. Is women get over 40, and as their hormones do change because their ovaries are not really cooperating anymore, that's when the 12 systems come into play. And that's what you're at higher risk for your glucose going up because your hormones have changed. You're at higher risk for your cholesterol getting worse because your hormones have changed. Like, you're at a higher risk for some things that really don't have a symptom associated with it. If your triglycerides right now were through the roof, I'd have no idea. There's no like real outward symptom that's probably going to show up and tell me. But I don't want to miss it because of the risk for cardiometabolic disease down the road. So once you hit above 40, it's for sure yearly. I may even have you be doing some of these things twice a year.
Now, where do you go to get something like this?
You can go to your primary care. You can seek out somebody who specializes in hormones. And in some cases now, thank goodness in the world we live in, you can order your own lab work. There are groups and clinics and, projects out there where you pay a fee, a certain amount, and it's a standard lab order. So you'll go to your local Quest or LabCorp, which are the two main big blood draw places, and you'll submit the order and then you'll get all the results back. The problem with those is that they don't always have the best way to help guide you, coach you through the results once you get them. Some of them are straightforward. You'll get a vitamin D level. You can see if it's high, low, or in range. You'll get an iron level. You'll see if it's high, low, or in range. Like, that's easy for you to tell. Some of the other markers, though, they have weird words and they mean weird things, and then it can be harder to like put the big picture together. But it is a start. If your primary care or GP is like, no, you're too young for lab work. You don't need that now. You can at least get the ball rolling yourself, order it, and then take it to somebody.
So if I were to do this by myself, or a listener would do this by themselves, who would they take it to? Would it be that like hormone specialist, or could they just take it to a GP?
They can do both. So there are, let's say you have an OBGYN and your OBGYN doesn't do the kind of like lab work or hormone testing you do, but you really like them as your OBGYN. It's totally cool. You can absolutely keep them as the person who does your PAPs or who delivers your babies. And then you're going to find somebody who has a better understanding of lab work. This is going to take some investigative work. You may have to ask around your friends, your family, the groups that you're in, of like, hey, do you have a healthcare practitioner you really like? Do you have a healthcare practitioner that, likes labs or likes to understand labs or is maybe more integrative or functional or holistic? Who do you see? And then make an appointment to have them help you read the lab results. Or on the flip side, I start asking around now, find somebody with that bent to them, and then have them order your lab work. And then they'll come back, and then they can choose what's right for you as an individual, and then have you come back and go over them.
Now, for the most part, I'm going to generalize this, but obviously there's a lot of nuance to the lab work that you get. Can you make course corrections and changes fairly quickly?
So it depends what and why.
Okay.
I would say iron is a great example.
Yeah.
If you are a person who doesn't eat a lot of iron-rich foods, and we see that your iron is really low, or maybe you have really heavy periods, so you're bleeding out all your iron, then we see on results, oh my gosh, your iron's super low, you're iron anemic because your periods are so heavy. Like, okay, let's figure out why your periods are so heavy. That may be medium quick. That might be quick. That might be slow, depending on how soon we can get it figured out that your periods are so heavy. Same for, vitamin D is usually quicker, because if you are not out in the sun and your vitamin D is quite low, it's like, well, you're probably not going to be able to go out in the sun very much if you have a job, or if you're in an area like me that doesn't have a lot of sun in the Pacific Northwest. Then usually they're like, well, let's go on supplementation. Like, let's just get your vitamin D up through supplements. And then that's much quicker. So it kind of depends which of the markers is the issue.
Got it. Love that. Now you are, gosh, a wealth of information. I feel like we could still take this like a whole nother hour. What is something that we haven't talked about that you want more women to just know about themselves and their bodies?
I would say, one, be an advocate. So we've talked a lot today about like what are hormones, what do they do, what are symptoms. We've touched on lab work. But I find, even being a doctor myself, like in the field of medicine, not everybody gets the same training, and not everybody has the same sort of urgency that you have. So it's okay to listen to this, take a lot of notes, and advocate for yourself. If you go to your primary care and your primary care is like, you don't really need lab work, or I don't think that's an issue, or that's so common in women, like best of luck. Like, move on. Find somebody else. That's when you ask your network. Be an advocate. What used to be back decades ago was what the doctor said went. And now it's like, no, I'm not standing for that. And we have enough practitioners out there that really are wanting to listen to you and to help you and help you navigate what's going on. It does take some investigation on your part to try to find somebody, but please be an advocate. Don't be shut down. Don't take it as, oh, I guess nothing's wrong with me. If you don't feel well, like you don't feel well, that's reality. Let's get it addressed.
And there are so many other women going through probably so many similar
Yes.
symptoms and feelings that you are. And the more we talk about it, like have these conversations, the more hopeful I am for everyone else to speak up about how they're feeling and get the attention that they need.
I was just talking with somebody the other day who has PMDD, which is premenstrual dysphoric disorder. And I said, which way do you go? Do you go the rage way or the depression way? And she said, oh my gosh, depression, anxiety, and panic. That's the way that I go. And she said, she's young. And she said, for so many years, I was just told that's normal. Well, women get PMS. Like, women can get depression. Like, women can get anxiety. Like, that's not uncommon. Oh, well, you're so busy. You have all this stuff going on. Like, it's not uncommon. So it was almost like she was patted on the head and pushed along until it got so significant, it was interfering with her daily life. And finally, in talking with her, myself and another doctor were like, I think you have PMDD. This is pretty significant, and we need to step in. We need to find you the help that you need. But it's not an uncommon story. No matter if somebody listening to this is 22 or 52, they're probably nodding their head going, oh yeah, I came to my practitioner with this symptom and I was told like, oh, that's to be accepted. That's not accepted. That's not such a big deal. And so by getting all this education out there, I think women, just as you said, are realizing, oh, I'm not alone. And common doesn't mean normal. And there's something I can do about it. So let's go.
And everyone that is listening, you guys, please make sure you give Dr. Carrie Jones a follow. You posted something very recently. It might have been yesterday. You in your 30s, you don't have perimenopause symptoms. And I was like, oh my gosh, like we can actually even have them in our 30s. And, that could be a whole nother discussion that we have as well. And you just have such a wealth of information. Thank you for the analogies. You broke things down so well. Where can people find you? Where can they hear and learn more about you?
Absolutely. You can find me on my website at drcarriejones.com. I actually happen to, on the website, have a number of free ebooks. Hormones 101, perimenopause, menopause 101, labs we talked about. So get yourself an ebook, get yourself educated at drcarriejones.com. And on Instagram, as you mentioned, I am at dr.carriejones.
Is Instagram where you mostly are? Are you on TikTok too?
I have dipped my toe into TikTok. I'm on TikTok because, like I said in the beginning, I want to learn how to be an adult, and TikTok has shown me a lot of things I didn't know. But I do have some videos, yes, on TikTok as I expand in. Although, who knows what's happening with TikTok? One day it's getting pulled, the next day it's not. So, Instagram. I also do have a YouTube. I've been doing a lot more YouTube videos over there. So they're quick, 10 to 20 minutes about hormones. YouTube.com/at Dr. Carrie Jones.
Well, we're going to send you this too, so you can take the clip about the text message. So you can literally make that, and you can make that
I will.
5 TikTok videos in one.
I love it. I will. Thank you.
Thank you so much for being here. I appreciate your time and all the value you put out.
Oh, thanks for having me. I love educating, and I love that you're out here educating just as hard.
Amazing. Thank you.